So one of the things that's key, living in a city that's mommy and baby friendly, that we have a body or a community of women that feel empowered about their bodies, and that they are birthing in a space, in a community that actually welcomes their voice, that respects them regardless of their race. I would love to see policies and systems in place that embrace that as well, so that a woman doesn't have to fight so much for her rights in this community, that the community actually gets it.
Let's talk about the benefits to mom and baby.
We can go all day. We can go all day. That initial skin to skin helps moms bond. They have a appropriate parental attachment, the higher IQ scores, the less asthma, obesity, eczema. We can go all day.
And for mom, the long-term benefits of breastfeeding, like reduced risk of breast cancer. And then for families, like the cost of breast milk is free. And so breast milk actually helps the premature infant to actually be able to survive. In addition to the maternal mortality rates are higher, the infant mortality rates are higher in Louisiana as well, and especially for Black women. So breastfeeding is a protective factor for those babies that are really struggling in the hospital.
And you start to see an inverse relationship. Areas where they have high breastfeeding rates have low maternal and infant morbidity. So if we can narrow that gap, we can even that out.
Maternal mortality in the U.S. is, the rate is one of the highest in all developing countries. And sadly, it's actually on the rise, despite decreases elsewhere. And this is really counterintuitive to advances in medical care, better access to prenatal care.
What we know about maternal health disparities that are happening right now is that women of color are dying at a rate that is 4 times greater than white women in this country. And that's the cause of negligence. It's the cause of implicit bias. I think what we're trying to do is change and shift the perspective of when that client walks into the hospital, what is the doctor seeing? Are they seeing a human who's scared and who needs their help, or are they seeing a demographic?
One big issue that I also, and we talk about this all the time, is that in some cultures, especially African American, you only go to doctor when you're pregnant. Like, you don't have a primary care doctor, you don't have an ENT, you don't have this and you don't have that. In Louisiana itself, we range between 48 and 49 in breastfeeding. Currently, the minority women, which is like African American, Asian, Spanish women, they are breastfeeding 3 times less than the majority. So their initiation rates are low and their continuation rates, like at 6 months and 1 year, are lower.
And the care that Black women get in New Orleans and elsewhere is likely very different. We all hold implicit biases, and there are movements locally and nationally to start to address this.
And so that's why NOLA Baby Cafe was so imperative for our community, is because once the women left the hospitals, that was it.
This is something that we need to be doing. We need to be like holistically supportive of our women. We're not just answering to their desires, but we're also answering to their needs and to the needs of our children. So we should be coaching other dads like how to be supportive of their wife to breastfeed, because there's always seems to be some type of apprehension.
When a woman is breastfeeding, she needs the support of her husband. She needs the support of her family, her mom or the grandmother in the family. She needs the support of her employers in order to get through it.
Like, we need to see people who look like us and talk like us and who understand what's going on. I would like to create a paradigm shift in the thought process of how we feed our babies. Some moms are scared to breastfeed their babies. I want moms to feel like that they're the only person that can do that, and that's the best choice for their babies.